start of the pandemic, we wanted to use this learning series as an opportunity to share best practices and tips for facilitation and participant engagement. Okay, so on our first session, our panelists discussed engagement strategies for the virtual classroom, such as polls, whiteboards, and breakout rooms. And we learned approaches for addressing virtual burnout and audiences reached. And we got great tips for productions and facilitation. So for those of you who were able to participate on session 1 and complete the evaluation, we do thank you for that. That was really helpful for us to really frame session 2 and address some of those topics that we weren't able to address on session 1. And then also, some of the comments that was very helpful for us to see how can we make the second session even more engaging so that you can take this information back with you. Okay. So one of the topics that we got, one of the comments that we got in our evaluation last time was to go into more detail. Sorry about that, technical difficulties. Thank you. Some of the last time we had learned about Mentimeter, and some attendees really want to learn more about that. So we want to take the opportunity to go into deeper about Mentimeter. Something else that we learned last time was that although it was really great to have presenters who were not using visuals, because we really wanted this to be more engaging and more of a conversation amongst us, we learned that it can be helpful to have some type of visual. So we have asked our presenters today to use that to accompany their talk. Okay, and for those who were not able to join us in session 1, there is a link to the recording. So Victoria will include that in the chat. So we ask you to go ahead and check out session 1 when you get the chance. So for today's session, it will include representatives from multiple FTCCs in a panel format. Our focus would be on some of the tools mentioned in session 1, such as skill-based training strategies and more in-depth discussions on things like virtual preceptorships. Each panelist, each section, there are going to be 3 sections today. In each section, there will have 2 panelists. Our panelists will have 7 to 8 minutes to present their component, and then we will take about 7 to 8 minutes to do a question and answer with our panelists. During this time, you can ask your questions, or you can also share your experience with these tools that they're talking about. We also encourage you to continue to use the chat box to ask your questions, engage with one another. Our panelists will address those questions either during their Q&A or through the chat. So we definitely want to see that level of engagement continue throughout this session. Okay. So at this time, I will go ahead and turn it over to Victoria.
Thanks, Liz. So as Liz mentioned, we're on a webinar, so you do not have the ability to unmute and ask questions, but we would love for you to put them in the chat box or use the Q&A feature, whichever one you prefer. If you want to add any questions or comments, but you want to keep them anonymous, you're also welcome to send them privately to myself or Liz, and that way we can make sure we get them addressed, but go ahead and keep it private. So with some of the things Liz was talking about, how we were taking things from our first session into our second session, we learned about the infamous Fauci faces. And so you'll get to see Fauci faces a couple times today, but one of them we wanted to show you is ask how you're showing up today. So you'll see the screen, you'll have to move the poll, but you can see 5 different faces of Fauci. And then on the poll 1 through 5, so go ahead and select which one you're feeling like to be like Fauci today. Just kind of gauging how everybody's showing up. So I'll go ahead and give that just a couple more seconds to see what our results are. And it looks like the majority of folks, we've got 42% are on 2. So we can interpret that how we would please. But thank you for taking that poll. And we just had another quick poll. We wanted to see about how you all felt from our first session. Which one of those panels did you feel like you took away the most tools from? So we've got virtual tools, addressing the virtual burnout, practices for production and facilitation. I loved them all and can't decide. I'm sure that'll be the winner. And then the other option is you were not able to join session 1. So I'll go ahead and give that again a couple more seconds. Appreciate you all taking those polls. I knew it. It would be, you loved them all and can't decide which one was your favorite. So that is great news. Our presenters from last time will definitely appreciate that. But with that, I'm going to go ahead and turn it back over to Liz, who's going to get started with our first panelist.
Great, thank you, Victoria. So without further ado, because I know we're all excited for today's three sections. So I want to start with Virtual Labs 2.0 and Mentimeter overviews. And we'll have today's panelists, Dave Clausen and Lisa Curry. So I'm happy to turn it over to them.
All right. Hello, everybody. I'm Dave Clausen, Director of the Mid-America Prevention Technology Transfer Center. And I would like to welcome you to the Mid-America PTTC's office, aka Zoom, where we've spent nearly every day for the last year. Now, we're housed at ACT, Missouri, which is based in Jefferson City, Missouri, and we've been serving the substance misuse prevention field at the grassroots level for almost 30 years. Now, we serve as a prevention catalyst, empowering individuals and fostering partnerships to really promote a safe, healthy, and drug-free communities across Missouri, Iowa, Nebraska, and Kansas. Now, our TA recipients range from state-level prevention leadership to regional prevention resource centers and even community-level prevention coalitions. Now, you may have heard that collaboration is the key to making an impact, but we want something stronger than just working together on a project. We want to create a culture of community across our entire region. Community being that stronger bond based on shared values, goals, and interests. From that rural one-person team to state-level leadership, we're all on the same team. And the more we come together, the more we can make our communities safer, healthier, and happier. Now, that's the official intro, but here's the real secret. It starts with why. Our why behind everything we do is to create a culture of community across our region, so that we can support each other and making our communities safer and healthier. So why we do what we do is because we believe prevention is better together and that together we are stronger. How we do what we do? Well, we leverage technologies to foster and build connection. It just so happens that we provide substance misuse prevention training and technical assistance. Oh, got to catch my breath there, right? We can actually talk about my setup here a little bit later if you'd like. But our prevention leaders are, my video's not playing. All right, we'll continue anyways. Our prevention leaders are leading prevention efforts in their states, region, towns, and communities. That means bringing cross-discipline stakeholders together on the same mission to promote those safe, healthy, and drug-free communities. These involve a range of strategies from individual all the way to environmental strategies such as state-level policy change. Now, before COVID, this meant convening meetings, going into schools, offices, bringing people together. Now, in this COVID era, as you know, the whole bringing people together looks a little different, a lot like this Zoom meeting right here. But the show must go on. The mission must continue. So we asked ourselves, how can we help our folks continue the mission? As TA providers, we might be comfortable and skilled in this virtual world, but our prevention leaders' virtual delivery experience was likely limited to just attending the occasional professional development webinar. So who couldn't use a little help keeping their team together, on track, and working towards those common goals? So we grabbed our friends at Hugh Life and launched a series of 6 virtual labs for each state in our region. They range from virtual meetings 101, hosting virtual conversations, how to facilitate virtual brainstorming, how to stay informed, connected, and productive, and then also moving from issues to action. Now, these were labs. They were an all-out experience where the folks got in and got their hands dirty working with these tools. And in my remaining 4.5 minutes, I'll give you all a few highlights so you can build on the tips and tricks from session 1, plus the amazing lineup today with Lisa's engagement tool, Bruce and Mary unpacking the roles needed to help create the experience, and Tony and Kristen digging into how they've rolled up their sleeves for some great skills-based training. Y'all ready? Because here we go. When planning a virtual service, it's easy and logical to start with the rational aim. But in this virtual world, we must be even more intentional about the experiential aim. In person, folks can interact with each other. They can feel the energy of the room and of the trainers. And you can kind of feel if somebody's not quite comfortable sharing their voice. So in the virtual world, we want to design an experience where all voices can be heard, valued. Everyone feels safe, comfortable, and able to participate. And if you want to increase your engagement, pay close attention to the experience. So kicking off a virtual event, you want to set a good tone for the event, right? So let's talk about introductions. Speaking over people, missing people, and it can just be downright frustrating. So who wants to start off like that? One method that we've used is a shared Google Doc, as you see on the screen here. When folks are coming into the room, invite them to join you in the doc and add their info. This gets folks engaged before the event even starts. They can see who's in the room with them, and that's even sparked some connection and conversation right there among the participants. And for some events where that peer-to-peer connection really is a big goal, we'll add an optional column where they can add their email to really help foster those connections. And you can use this same list to then go through formal introductions. One way that we teach is to use the stacking method. And that gives everybody a heads up when they'll be next so they can prepare themselves to come off mute. And just for fun, I thought I'd demonstrate that stacking method with a couple of my friends here real quick. This is what it will sound like. We're going to use a stacking method for introductions. I'll call 3 names at a time so you know what order we're going in so you can prepare yourself to come off mute. So let's start things off with Newman, followed by Jerry, and then Chuck. All right, Newman, what do you have for us?
Oh, Jerry.
All right, thank you, Newman. Next up will be Jerry, followed by Chuck, and then Alicia.
Hello, Newman.
All right, thanks, Jerry. Next up will be Chuck, Alicia, and then Katrina. All right, I think y'all get the point there, right? That's how that works, makes it so smooth. You get to hear everybody's voice. So building on that, the importance of starting things off right. One of our best practices would be sharing and talking about agreements for a virtual meeting space. Just like we do for in-person training, it's always good to start with these agreements. We'll talk through each of these, then we'll pause and ask the participants to share which ones resonate and which ones stood out to them the most. And then, are there any they would like to add? We'll even have them annotate, drop a heart or a star on the screen next to the one that they really like. Hey, right there, more engagement right up front. And I can't stress that last agreement enough, having grace with yourself and with others. This is where we as leaders can also help shape the safe and trusted environment for our virtual event. And then we all favor a certain way of thinking. It's not that we only think in that one way, but we can and do think in all of these ways. But we often have a bias towards one or two that we find ourselves more energized or comfortable with. You know, do you find yourself gravitating towards any one of these thinking preferences? Drop it in the chat box. You know, the data folks, give me the facts. Emotive, how are people impacted? Visionary, let's get creative and innovative. Critical, let's be realistic. And then action, what needs to happen? Awesome. Now, as you see that chat box, each one of these different types is being represented today in our session. But in addition to these types of thinking preferences, there's also your crockpot thinkers that need time to think about their ideas and formulate what they're going to say. There's your microwave thinkers. They can't help themselves. They have so many ideas immediately and share them freely and often out loud. So what does this mean? In order to engage everyone meaningfully, we need to offer a variety of opportunities for engagement and create space for all types of thinkers to participate. use their voice, chat, anonymous Google Docs, polling. Stay tuned for Lisa coming up next. So this is what it can look like. This is our team report out. You know, everybody thinks a little bit different. They get engaged in other areas. So now this is how you can facilitate a conversation for a virtual event that really reflects all of those different types of thinking and engages people in an inclusive and respectful way. We use this with our joint TTC advisory board. This template creates space for all of those thinkers, facilitates an effective conversation, and keeps the teams on track and on task. We'll fill out boxes 1 through 3 ahead of time, and then we work through 4 to 7 as a team. And as I come to the end of this 8-minute mad dash, if you're gonna remember one thing, just remember this. Be intentional about designing your virtual events, taking heart to the overall experience that you are creating. Create that safe, trusting experience and environment to engage folks in an inclusive and respectful way. And next up, we've got Lisa to really dive into some more engagement tools. Thanks for listening, and I'll catch up with the chat box here momentarily.
Well, thanks, Dave. I appreciate that. And you've provided a great segue into demonstrating a specific tool that is great for helping with engagement and meeting some different learning styles. So I'm Lisa Curry. I am at Maytech, Wisconsin, which is Midwest AIDS Training and Education Center. We're located at University of Wisconsin-Madison, and where I'm a program coordinator and training specialist there. So a number of you in the first session mentioned Mentimeter as a tool you're interested in learning more about, thus the demonstration of that here today. And so I wanted to talk a little bit about it first and then demonstrate a couple of the types of polling questions that are available in Mentimeter as a way to familiarize you with it. So those of you who have already used Mentimeter, this will be a refresher, but for those of you who are, this is a brand new tool, then this will be an opportunity for you to learn. So let me just share my screen here, and this will give you a chance to get a sense of what it is like. So just a couple of quick points about using Mentimeter, or Menti as it's oftentimes called. And that is, first of all, it is very useful in different kinds of settings, in order to help with participant engagement. I first started using Mentimeter in my past life as a college health educator, and when I was trying to engage these very large groups of 500 or 600 students when they were attending these mandatory orientation programs on topics that they weren't interested in being there for, like alcohol and other drugs. So, but I've also adapted it into very small in-person trainings as well, for a variety of different audiences, and especially where it's a situation where death by PowerPoint was definitely a threat. So it's the only thing I would say is it's important to understand that people who are you need to have an audience where the people have a device available to them. So whether that be their smartphone, whether it be a laptop, something that has browser or texting capability. So that is something to be aware of. And I guess harkening back to what Dave was saying about minimizing distractions, it does put people's phones or device in their hands while you're actually asking them to poll. So there's a risk of distraction there, important to keep in mind. But I think that the higher level of engagement is I think a benefit that may outweigh that risk of distraction, especially once we get back to doing in-person trainings where you can ask them to then put it away once you're done with the polling. Currently, one of the uses we're using it for is in our intercollaborative practice and HIV care course that our office supports within it's an academic course that we support, and so our students really engage with it really well. But I've seen it certainly work with a wide variety of audiences, and so I would say don't be afraid to use it. It's just one polling software that's out there. There are others such as Poll Everywhere, but this is one that I'm finding is actually quite useful. Certainly it does, as you can imagine, it does help to meet a greater array of learning styles. Dave alluded to this with crockpot thinkers and microwave thinkers. Certainly, I think a quick poll can help with the microwave thinkers who have that quick response. But even it can help if you're presenting a bunch of different options to a microwave thinker. It can really help to say, oh, yeah, I guess that's the thing that might be on my mind, and can get them engaged quickly as well. So it's definitely an option there as well. And mix these things up for you as a presenter as well, which is better than just simply having a purely didactic type of presentation, even though there are some people in the world who still love just a didactic presentation. All inputs anonymous, which, with any poll can be beneficial, especially if it's a more challenging or difficult topic that you're polling on. And then even if you're co-presenting, you might even have the opportunity to build a poll on the fly, which can be useful if something comes up that you want to ask a question on pretty quickly. One thing about Mentimeter that I like compared to WebEx or Zoom, some of the in-platform polling options that are there, is you just have a greater array of different polling options. The image that you see here next to the words on the screen shows some of the question types that are available: multiple choice, word clouds, open-ended, scales, ranking, many different types of questions. So you can go beyond just a simple multiple choice, yes, no, true, false, that you might get within WebEx or Zoom. And so you just have some variety there that's really going to be beneficial. And then also, lastly, I would say, though, the biggest word of advice I have is really just to make sure that you're using it in a purposeful way. And I think this is true with any polling, regardless of the software, or even if it's the in-platform polling with Zoom or WebEx, whatever you might be using, is that it's purposeful, that you're using it to gather information that supports whatever it is that you're presenting on, that it's not just simply gathering information for the sake of gathering information or whatnot. Certainly it can be for a moment of fun if you like, to break things up, or if you're using it as an icebreaker or get to know you at the beginning, just as was demonstrated today with Fauci faces. But I think that, especially when it's built in to be part of the flow of the program, it's important to be purposeful in that, and not to overuse it, because that can also become very annoying for participants. So on that point, I think it's time for us to actually get into it. So I'm going to demonstrate a different way of doing Fauci faces, just to contrast what we saw before with the Zoom built-in platform. I'll show you how to do a Fauci faces within Mentimeter. So what you'll need to do is, on your device or on your phone, go to menti.com, unless you're really fancy and you have the Mentimeter app already on your phone. Go to menti.com, and you, for the meeting, or for for our poll, you'll put in the number 1642-8216, and I believe that Dave has dropped the link to that, direct link to that, also in chat. So what you'll do, once you pull up the poll question, you'll see the poll question come up once you enter in that number. Then you can actually respond with, I have a 9-point Fauci face scale instead of the 5-point Fauci face scale. Super fancy today. And you can respond to that question then on that poll. I'm just going to give you about another 30 seconds or so to respond how you're feeling today on the 9-point Fauci face scale. And I can't see the chat, so let's see if I can. Yeah.
We've got the link in the chat.
There's the chat. Okay, great. Just threw the chat on my other window, so now I can see it. Okay, so I am going to just give you just a few more seconds to finish that poll, and then I will reveal the results. Hopefully everyone's have a chance to connect in to menti.com, enter our number, and then give in your poll results. So I am going to reveal our results now. There we are. Look at this. Most people are at a 3 today, it looks like, but a good array. Nobody's down at a 9, so I think that's good. Most of us are up towards the top end, so that's great. So different there. You can see the contrast in 2 different ways of polling a Fauci face, if you want to, either within WebEx, or I'm sorry, within Zoom or within Mentimeter. 2 different ways of doing that. Just to demonstrate how you can do the same thing with 2 different polling platforms too. Okay, so now I'm going to move on to a different type of poll. The next one we have is a word cloud. And in the same screen, you should now see this question come up if you're still in the same event in your browser or in your phone, and start entering in, assuming that money and time is no object. What country would you like to travel to when it's safer? And the more entries we have for any one country from y'all, the more it will come up. So, oh, St. Patrick's Day today. So a lot of Ireland. And actually, I'll give you the secret. You can put it in more than one country. You can put in up to 3 if you wish, 3 separate entries. So you don't have to put them in all at once. You can do 3 separate entries. So you can see what one of the fun things about this is, literally as your participants are putting in their entries, you can watch it change and see how this, okay, we have a Star Wars fan in the audience because I see Endor. I love this. I'm a big nerd myself, so I love that somebody wants to go to Endor. Okay, lots of variety. Greece is a huge winner today. New Zealand, of course, New Zealand being very COVID safe right now. So, okay, we're just going to give it a few more seconds, even though this is continuing to change. Okay, I think now you're playing with me about Endor. Dave, is that you? I think that's you playing with me about Endor.
Negative. It is not me.
Oh, it's not. Okay.
No.
Well, folks, I think that shows you the possibilities of what a word cloud can do. You can ask a question and get a lot of input very quickly in a very fun way. This was, like I said, we used this within our intercollaborative practice class to get a sense from our students about what was their response to the class at the end of the semester. And it was really just like a 1-word response to their reaction to the overall class, and that was just a fun way to end the semester. And so, just a neat way to continue on. I'm going to move on to the next, in the interest of time, I have to move on to the next one. So I love all your travel plans. I hope y'all better get your passports updated. So, and get your vaccines, because we're getting closer and closer all the time to the end of this, to that time when it's safer. So, okay, happy travels, everybody. Okay, one last slide here, and this is actually a demonstration of a quiz type question. So those avatars there all represent you as individuals, and what we're going to do is just have a quick quiz question here. And I'm not doing this as a leaderboard style. You can actually put this in as a leaderboard if you want to have a competition to determine who's going to win, but we're not going to do that today. Just going to ask you a quick question here about whether you might actually use Mentimeter in the future. No winners, no losers here. So you're going to have I think I have the timer set for a moment. So take a look at this question. Will you use Mentimeter in a future training? Yeah, you just got 20 seconds to answer this. So I'll show the results when we're done here. 3, 2, and 1. Time's up. And look at that. Okay. So majority of you definitely will consider using this. Another good chunk of you say, yeah, it's worth considering. And somebody says, hey, maybe not, but yeah, it is fun to consider. So, definitely, I think as a tool, again, another tool in your arsenal, it doesn't have to be something that you're required to use by any stretch of the imagination, but it is a fun tool. And I asked fun questions today. It can be used for serious questions as well. And that because there are a variety of different poll type questions available to you, you can use it for a variety of different poll questions. So keep that in mind as one tool that you can put into your arsenal during your presentations in the future. So I think it's my turn to turn it back over to Liz.
Great, thank you, Lisa. So thank you to both Dave and Lisa for that review of those tools. Certainly something I'm going to look into when it's time for our meetings or for our training. So I appreciate you sharing that. So we want to go into our Q&A, and I know we already have a few questions already in the Q&A. So just as a reminder, you can add your questions to the Q&A on the bottom or to the chat, and we'll get to them. So I want to start with some questions for Dave, and if you can briefly go over again, what was the program you were using to show your video and slideshow together?
Sure. So that is OBS, so an open broadcast software. It's free to download. And you basically create scenes or layers of images and inputs. So the frame around my webcam is an image that I made for free on canva.com. And then the next layer would be my actual webcam input. Then behind me, I have the virtual background, which is an image as well. So you're able to layer all these together and then send it as one signal through your webcam into Zoom. So I did that. And I just had the desktop side by side as well on my screen, if that helps. Once you get it set up, it's not too bad, but it's got a little bit of a learning curve.
Great, thank you, Dave. And more of a shout out than a question, but you're such an innovator and a great presenter, Dave. We just wanted to let you know that. So for Lisa, one of the questions about Mentimeter is there a cost to get Mentimeter, to use Mentimeter?
That's a great question. Yeah, I don't think I mentioned this. I was planning to. So you can get a free account, but you're very limited in how many questions you can ask during a presentation. You can, I think, ask maybe 2 or 3 questions, or 2 or 3 polls, I should say. And so that's what I was using today, was the free account, but it has quite a bit of limitation. But you can go up to a high number of participants in terms of how many people answer that polls, up to like, I think 2,000 participants. So it's quite large, but it's just you're restricted in how many polls you can do. A paid account, and I haven't looked into the actual cost because it depends upon the size of how many polls you want to do, and the size of your audiences. So there's different levels of pricing, but if you go to their website at mentimeter.com, they have the pricing all laid out there because there's different tiers available. So you can check it out on their website really easily and find out what might fit for your needs for a fully paid account.
There was another question, I think you answered this through your presentation, but can you offer more than one question, and do you get a new number for each question? And it seemed like we were able to use the same number. Is there a certain number of questions you could have added for that group?
You mean the code number that I shared? The code number was stable for the presentation I had created. So even when I was practicing it, for example, Dave and I practiced this yesterday, we had the same code number yesterday when we were practicing as today. So that 16428216, same code number. Once I created that presentation, it's the exact same one. It's like creating a WebEx link or a Zoom link. It's the same link once you create it. But in terms of the number of questions, that depends upon that you can do. The number of polls you can ask, that depends on whether you have a free or a paid account. But you can ask a variety of different types of questions. So, yeah.
And another question for Lisa was more so, in those times that what if you get a vulgar word using Mentimeter? I'm assuming, is there a way to erase the cloud or deny that word?
I'm not certain about that. That's a great question. I have not looked into that, so I don't have an answer for you. I'm not seeing the words as they come in. And so like in a stream or something, behind the scenes. And so I don't know if there's any filters like behind the scenes to control that at all. That's a great question, though. I just haven't looked into it, so I can't answer it.
Thank you, Lisa. So we have another question. What do you plan for backup just in case polling software doesn't cooperate? We've all been in live trainings when web-based polling doesn't work as expected.
Yeah, that's a great question, man. And I've certainly had that happen multiple times. And usually it's been with in-platform polling that I've had it fail. And, so for example, if it was just a quick question, either a yes or no or a multiple choice question, we'll just try to either give the options verbally and then tell people to give the answers in chat. Or if we can quick run up a slide and put them up on a slide and again use chat as an option. But it's usually been a problem when it's been in platform polling instead of Mentimeter or another like software-based program that I've had problems. So, I mean, again, if you're co-presenting and you have a producer or a tech support person that you're working with, and they can do kind of the work behind the scenes to fix it, then that gives you the bandwidth to say, oh, can we can we fix this behind the scenes before we have to go live, or can we delay the poll until later that's why again I say don't rely on this as your sole tool. Don't use 17 polls when don't over rely on something like this. You may annoy your audience, but try to be focused and purposeful in its use, and have contingency plans. So whether it's just going to chat, or if you're in person, obviously you can do raise hands or paper poll or something instead. So.
Absolutely. Thank you for that, Lisa. We appreciate it. So if there are any additional questions for Dave and Lisa, certainly add them to the chat. We can also address them again at the end if we have some time. We're going to go ahead and move on to our next set of panelists who will be presenting and describing tips and tricks for setting presenter expectations. So we'll start with Bruce Nader and then turn to Mary Faria. So Bruce?
Hi, everyone. Give me just one quick second to share. Lovely. Hi, everyone. I'm Bruce Mader. I'm the director of the Infectious Diseases Education and Assessment, or IDEA group at the University of Washington. And at IDEA, we created the National STD curriculum as a part of our NNPTC work. And then we also did the same for the National HIV curriculum as a national AETC training center. And then we also ran the STD ECHO, or STD Technical Cooperation Group, which was adapted from the ECHO model. So that's how I'm here today, representing a few places. And let's start with a quick poll. I love polls. Have you been a part of a learning community or even worked on one? Please answer now. And maybe you weren't sure. We use the words learning collaborative or learning community, oftentimes maybe not always understanding what that means. So let's answer that now. And whenever we have the right number, Victoria, just publish the results would be great. Nice. Oh my gosh, you guys are pros. This is going to be a snap. When thinking about the learning collaborative environment, the enduring nature of the training, the ongoing commitment from participants, we have to focus on like the fundamentals, the building blocks of the learning collaborative. So we always start with the content, right? And those who facilitate learning communities are rarely presenters. So I'm going to speak about setting presenter expectations specific to a learning community or learning collaborative. And yikes, there you go. The content is the key. I often talk about titrating content to meet the needs of your audience, hence this picture of titration. So pre-session, that means taking the time to plan content with your presenters. Is it a one-on-one training session, or more likely it's specialized around a certain topic? Think about what will meet the needs of your audience. Facilitators need to communicate with presenters well in advance and have a clear set of learning objectives. Next, and this is the hard part, right? Presenters need to provide their slides well in advance for review. The best learning collaborative sessions are those where the content feeds your mission and goals. The pre-session planning and review is key in making that happen. And I know you know this, and it seems like a redundant review, but the stakes for a learning collaborative are a little higher. If you have even a couple of sessions that are off or don't meet your audience needs, they might leave, and you just can't afford that. So plan the content in advance, make sure there's time built in with your speakers to review the content before the session, and then blammo, you have gorgeous content. Once you have this content, like cooked to perfection, you have to prime your audience and your participants. You have to entice their appetites. And you do that with cognitive priming. And really, all I'm talking about here is that, you just get your audience to think about the content. It's not an event, it's a process. You want to engage your audience before, during, and even after each session. So in advance, you can send out learning objectives or key questions about the topic. You could assign a reference article, just help set the table for learning, if you will. During the session, you want your participants to engage. One way to do that is through polling. I love polling, it works well in my setting. Those polling questions are great because obviously they engage the learner, but also they help your presenter to understand your audience, who's there, what are their experiences. And I think that's also important and often overlooked. And then polling builds relationships. So if you want that flawless performance, polling or some other tool is a must. And during the last FTCC learning session in February, those experts talked about the use of other things too on building rapport. So that was like the chat waterfalls, the Q&A in Zoom, the verbal comments when you're able to make those in a meeting setting in Zoom, breakout rooms, whiteboards, etc. And I want to say, I really love chat waterfalls. I don't think they're used often enough. And so what that really means is I think we need like a common definition. It's like somebody asks a question. It could be the facilitator, a presenter. You enter your information in the chat feature, and then the facilitator, presenter, or even a techie just walks through that, just like we've done today. It is a great way to get to know your audience. You know their names, you know their experience. I just recommend them. I love chat waterfalls, and I wish I used them more. I just think they're an amazing tool. And then finally, post-session, right? A great way to keep your audience engaged is to assign that asynchronous work, like say a podcast. You've developed a podcast on your national STD curriculum. Assign that outside of the classroom setting and let them stay interested as you move along. And then tips and tricks. So if you think of this as a clock, you have 15 minutes per didactic, there are two. This is the ECHO model. And then you have 15 minutes for each discussion. The discussion is key. The discussion is the most sacred part of the learning collaborative. It's when members have an opportunity to fully participate and engage. Do not sacrifice your discussion for content. I'll say that again. Do not sacrifice the discussion for your content. A way to avoid that tension when you have speakers like ratcheting up into your time frame is just go back to your content planning and review. It will just prevent your facilitators from being in this awkward position of having to cut off speakers by saying, hey, I'm sorry, but we're gonna have to stop there. Oh, another great tip or trick. We did this for the STD Echo. I just created a Word doc of the expected participant list. So the names of our expected participants came from the Outlook invite. So I just had all the names and then the city they were associated with, because we had a static core group. We knew everyone, right? But it was really great for our facilitators just to have a handout, like a printout of like Barack Obama in Chicago. Oh, Barack, how does it work in Chicago? What did you do? Oh, Donald Trump, you're in Mar-a-Lago. What did you do? That was just a great tip for our facilitators to easily call on people and know who's in the room without having to like scan the chat box. And then finally, my last one, oh my God, this is like a marathon. Look, learning collaboratives take a lot of work. Finding presenters week to week or month to month can be really tough. And at the root of my work and probably all of our efforts, right? We're training centers focused on workforce development. We want to build the pipeline of expertise. You want a good presenter? Create them. Turn your participants into presenters. This will increase group participation and buy-in, and ultimately just ease your need for new presenters. That is it. I hope to God I stayed true to my time. And then Mary, I happily turn it over to you.
All right, wonderful. Well, thank you, Bruce. Hi, everyone. I'm Mary Farias. I am the education lead for the South Central AETC. Although I've only been in that position for a couple of months, I've spent my career in learning and development, and I've worked with ECHO and at UNM, University of New Mexico, for nearly 6 years. Bruce, thank you so much for your great info on determining content needs and shaping presentations in collaboration with your presenters. I could not agree more with you on the sacredness of the discussion component of things. So I'm just going to continue on with some related concepts, thinking about, and are you guys seeing my slides? You may not be. Are you seeing my, yes? Okay, great. So sorry about that little glitch. But I'm going to talk a little bit about how starting with the end in mind when it comes to a community of practice is so critical, and also talk a little bit more about the specifics around the ECHO model, which Bruce alluded to in working with his STD program. So we have so many options when it comes to learning opportunities. Right, so we have online courses, we have the traditional model, we have webinars, we have didactic presentations, we have self-directed learning. All of these are options. So how do you know which is best? Is a little bit of a trick question, right? Because all of these things have pros and cons, and all of them are right, dependent upon the situation. And that's where beginning with your end in mind really is so critical, right? So that's going to be what's going to help you decide what's most appropriate. So we're going to assume, because I only have 8 minutes, that we've gone through that process and decided that we're building a learning community / community of practice is really the way to go. And so, you know, thinking about what the goals are and what you're trying to achieve, and then selecting the appropriate tool is really important, but so is changing your paradigm. So now I'm going to delve just a tiny bit into semantics, right? This is up until maybe like 20 years ago, and still into today, as we all know, this has been like kind of the traditional format when people think of training, right? It's an expert, you have a single expert here, you have masses of content up here, and you have, you know, this audience that's sitting there waiting to be the beneficiary of all the wisdom of the expert. And a lot of times we'll call this training or teaching, but in reality, a lot of that is presenting, which would be defined as showing, describing, or explaining something to a group of people. And in this model, you have a large part of the discussion is content-based, right? So that's everything you see up here on the chalkboard. I'll bet you that's a 50-minute class, and he's going to try to get through all of it. And there's this little slice for discussion. It's probably going to be more of a Q&A, and it very easily may be sacrificed on the altar of content, right? So thinking about a different model, right, which is this community of practice. So, and you can see here, there's no one person who stands out as the expert. People are leaning in, they're physically close. I mean, not so much that we can do that in the moment, but you get a real sense of teamwork and things happening together. And so this is really, and you know, you could say that this is learning or teaching also, but the shift in paradigm, I think that needs to happen is that in a community of practice, you've pretty much flipped that upside down. You have this little slice of content, and that is either information people need as an update or information people need so that they have a foundational level of understanding of something, presenting new information, and then you have this huge element of discussion around it. And so this is really where you get into facilitation, right? As opposed to presenting or training or teaching, right? Because what you're really doing with the community of practice is engaging participants in creating, discovering, and applying learning insight. And that's something that we're not frequently coached or taught to do, but it's a real change in paradigm that can be super helpful in moving in this direction. So let's talk a little bit about the ECHO model. which is where I'm really familiar, you can see that it is built around this community of practice model. It's been around since 2003, started out in a medical application, has since expanded globally and into areas like education and social justice. You do have some experts here, but you see that this is all this sort of loop, this learning loop is what you're trying to create. And that happens by applying 4 principles of the ECHO model, right? One is using technology. The second is sharing best practices. The third is applying case-based learning. And the fourth is evaluating or monitoring your outcomes. And by principles, these are things that need to be included in order to actually be doing an ECHO. You can do 1 of these things, 2 of these things, or 3 of these things and still be doing wonderful things. It may just not be an ECHO. And so I just want to go through these principles a little bit more because I think sometimes people think of them as a little bit of a straitjacket and have some confusion over what they are. But ECHO is really intended to be a very flexible model. So when it comes to using technology, it's not necessarily Zoom. Oftentimes people will say like, well, I use Zoom, so I'm running an ECHO, or they'll say, well, I'm going to do an ECHO, so I need Zoom. Not necessarily, and it's not necessarily just Zoom-like tools. So you can use Skype, you can use Teams, you can use whatever your organization wants you to use. You're going to incorporate all kinds of things, right? We've seen Mentimeter, we've seen some of the cool stuff that Dave did with different presentation, with having, his inset on the screen. You're going to use all kinds of technology in it, right? But at a base minimum, you're going to have something that is going to allow you to have a video conference with people. Best practices, you come into a community of practice with the assumption that everyone has expertise. We don't all have the same expertise, but everyone has a unique perspective, point of view, and information they can bring to it. So what you're really looking for is creating a learning circuit, not a kind of a unidirectional, sense of here's this expertise that's just being bestowed upon you, right? But really, that community comes in when I ask a question and someone answers it, and that answer sparks something for someone else. And you really get that lively discussion and learning from one another. Case component, super important because that's where theory, kind of where the rubber hits the road, right? Theory meets application. It is not necessarily clinical. Because we did start in a medical model, a lot of the ideas that people have is that cases are very clinically oriented. That's not necessarily true, and having some component of tracking or tracing your impact. And so hopefully these examples demonstrate that these 4 principles are a framework that really allows for significant customization, and it's not meant to be inflexible. It's not meant to be unchangeable. So just like you need eggs, flour, and sugar to make a cake, that doesn't limit your final product, right? You'll use those same ingredients, whether you're making chocolate cake, layer cake, red velvet cake, pick your cake. And ECHO works really the same way. So as long as you have those 4 essential ingredients, you're free to structure them and combine them in whatever way meets your needs best. So with that, I will turn this back over to Liz.
Thank you, Mary and Bruce, for those presentations. So at this time, we'll go ahead and get into our questions. Bruce, thank you so much. I see that you answered one of the questions. I don't know if you want to add anything to it, but one of the questions was, what is a chat waterfall?
Yeah, so, we often just ask a question, all the answers go into that chat box. But in a formal, straightforward way, somebody, a presenter, a facilitator, or even a techie can ask a question, answers go into the chat box, and then someone, the facilitator, presenter, or a techie, reads those responses, or it's a way to engage the audience to connect them. So it's used informally all the time, and it's been used really effectively here today. We don't always put the name to the use, but I really do find that attractive, especially in a smaller group setting where there's like maybe 20 to 30 folks. So for a learning collaborative, it really works, especially as you get to know everyone. And in a lot of ways, that's faster than a poll. What's great about a poll though, right? It's a different tool. You can get numbers. If you need a sense of the data to maybe move forward, the poll might be the best thing for you. But a chat waterfall is really quick, really easy, and it really does build community.
Thank you, Bruce. And this next question is from Mary. Mary, can you tell us what the ECHO stands for?
Yes, and this is keeping me on my toes, and so it's the extension for community healthcare outcomes. That is not at all catchy, and in fact, it was based on the old agricultural extension programs, which is why it has that name. But essentially, it's just a tool to democratize knowledge.
Thank you. So I actually have a question. What would be your one takeaway for coaching presenters? And we'll start with Bruce.
Ooh, I think much like for the presenters on today's call, distill your content into its essential elements. It was hard for each of us today because we had 7 minutes. It's the same thing for that didactic portion. Really focus on what your key messages are. If you just run through slides and like, oh, this is really quick, don't do that. Do not do that. Stop and focus on the essential elements. That is the key take home for me. Mary?
I would definitely agree with that. And also just to help them understand, they're not there to teach people every single thing they need to know about that topic, right? They're there to provide enough information to spark discussion. And if they've done that, then they've been successful, right? So I think that sometimes is a good way to frame it for people.
And thank you again, Bruce and Mary. So we'll go ahead and go on to our third and last section for today. And that's going to be on virtual preceptorships and skills-based training strategies. And we're going to discuss lessons learned. So we'll go ahead and start with Tony and then move on to Kristen.
Great. Thank you so much. I'm so grateful that I'm able to go follow everyone. And let me go ahead and start with my slides. Hello, I'm Tony Kepner. I'm from Mountain West ATC. And let me start with my presentation. Can you see it?
We can make sure you hit that second share button.
Okay, let me go back. Here we go. Hold on a second. We had... do this one more time. Share.
Awesome. Yep. And then you'll just hit your PowerPoint. Thanks, Tony.
Can you see it now?
Yes.
Great. All right. Thank you so much, everyone. So I just really want to kind of talk about the silver lining to COVID-19. What's exciting about using virtual, as everyone has talked about today, is that we've had an opportunity to do a pivotal shift going from in-person nursing preceptorships, which we've been doing since 1999, where we've done preceptorships for nurses, pharmacists, and practice transformation, which is my most favorite part. The standard format before COVID happened were we actually did 2-day in-person preceptorships. We used only 3 primarily educators, which was myself, a pharmacist, and then one other person, which usually was either usually a provider. And we did back-to-back topics. We were certified through the University of Washington, where the applicants submitted their request. We identified their learning objectives. We did pre and post assessment, and we set up their on-site training. The educators were all HIV certified providers and ACRN nurses. And we had a one-to-one time with trainers. And we would do case discussion, client visits, didactic and training tailored to the trainees. We've been doing this forever, like I said, since 1999, and we covered Hep C and HRA. And we would use EPIC, which is our electronic medical record, for case discussion and online resources. And we would use the National HIV Curriculum, AETC resources, and a variety of other relevant. We did offer CNE for this. The challenge about this, though, is that we did use limited online resources, but because we were having to do one-on-one relationships, we were limited in terms of when we could offer it, and we had to do back-to-back, so we could only do it like Monday or Tuesdays or Thursday or Fridays. These are the typical topics that we covered pre-COVID. We did HIV principles, nursing case management, antiretrovirals, STIs, and LGBTQ implications. What's really important, though, during all of this pieces that I want to talk about is that the emphasis is we want to grow our own, right? I mean, we're all getting older. We want to make sure that we actually really continue the workforce in treating our persons living with HIV. We want to make sure that we continue to have nurses, providers, case managers, medical assistants. But the silver lining to the COVID pandemic is how we had to pivot, right? For how to either telework, virtual meetings. I mean, you know, how we were able to kind of transition gracefully, which we have been able to do. Now, what happened though is that our one-on-one in-person preceptorships came to a halt. And what this created was a huge void in our training program. And we're a Ryan White clinic, so clinic continued on, but this created a huge void in our teaching, which actually personally and professionally, you know, was pretty darn devastating to us for this past year. And we thought, well, wait a minute, you know, who do we want to serve? We still want to serve our nurses. We still want to be able to provide something. And so we were using the ECHO model. And we thought we still want to build relationships. We thought we know how to do a community of practice because we all do learning collaboratives. We have a SPINS grant. Why can't we use all of those amazing pieces? So we decided to create basically a virtual nursing preceptorship, which would involve telemedicine. It would also involve the HIV nursing curriculum. And so here we go. I wanted to kind of show you a little bit about this hybrid or virtual nursing preceptorship. So we're basically going to we've created a virtual nursing preceptorship. It's case-based scenarios. We're using subject matter experts. So we've actually expanded very much using the ECHO model to create virtual strategies and best practices. We have met all of the CEU's requirements for this. We also, though, use storytelling modalities because remember, people remember the stories. If you can talk about, when you talk about opportunistic infections and you use case-based scenarios, people will remember that. You know, when you mentioned just a little bit earlier about discussion versus necessarily doing content, people will walk away and remember those. We still use the National HIV Curriculum, but we actually really integrate trauma-informed practices. They actually will have an opportunity to attend our virtual art therapy. We will incorporate Ryan White and public health and FQHC health promotion strategies. And then we'll even have telehealth visits with clients. This is just a snapshot of some of the way that we broke it down in terms of doing background HIV 101 or 501. We're doing polling with our trainees to figure out where they're at on the spectrum of what they need. This kind of talks about the process of the training, whether it's a virtual review with the lead RN and how many minutes it takes. We'll do rapid antiretroviral start because we're a SPIN site for rapid antiretroviral starts, and we do that with the intake coordinator, the SPINS navigator, the program supervisor. So we're kind of doing that ECHO community of practice. And then we're looking at treatment guidelines. So this is just kind of like a snapshot of how we're incorporating and moving from that one-on-one, in-person, and really being able to spread it out over learners' needs, whether it's over several days, it could be over several weeks, depending on what their schedule looks like. This is just my acknowledgement. Okay, so we get out of here. Sharing.
Thank you, Tony. So we'll go ahead and move on to Kristen. Kristen, you're on mute.
Thank you. I hope that you can see my video. So I'm going to play the video first and then talk a little bit about the National Clinical Training Center. And what we have done during this pandemic to help flip our face-to-face trainings to virtual trainings. And I will talk a little bit about after the video. So the video is of an IUD insertion training process where we have developed and recorded video which shows the procedure taking place, which would go in place of or in lieu of a face-to-face training where I myself as a skilled provider would teach new providers how to do this procedure. So much different than, say, updating someone on new medical management, but teaching them a new skill that actually has risk to it, and trying to make sure that we are giving all aspects of the training virtually as we would have face-to-face to ensure that providers are safe to go back and introduce these procedures to their practice once they have completed the training. So having said that, that was just a portion of the videos that we have done. And what I think I will do now is just talk a little bit about that process and what we did to flip a training that is a skilled procedure to a virtual training and make sure that the impact on practice was not affected. And one of the things at the National Clinical Training Center, it's supported by OPA, and we are here actually to support family planning, reproductive and sexual health providers in providing highly quality family planning practice. And so because of that, we really rely on this network of grantees throughout the United States to provide these services as a safety net, and many times to people that don't have access to care. And we want to make sure that that care doesn't suffer in lieu of the pandemic. And it took us several weeks to imagine the model that we would do. We do a Zoom didactic portion. They have pre-didactic work, and that allows us to just review skills when we get to the training on that day. We look at the videos, we work together. We have shipped supplies to each participant so that they have a pelvic model and all the supplies needed to do the procedure itself. And then we have also given feedback opportunities as they would get during a face-to-face, so they can work with each other, show me videos about what they're doing. I can give them feedback regarding those videos and what they might do to make the procedure go more smoothly. So having that vision of what the experience is like face-to-face and writing that down even, and then translating it to, if we are providing feedback face-to-face, how do we provide feedback virtually? And we rely a lot on our TA support to make sure that it's seamless the day of the training, and they have access to me or whoever is doing the training, post-training, to follow up with feedback opportunities, and they can continue to keep the pelvic model for 1 week before it's shipped back, and the rest of the supplies they keep for themselves. So having said that, just one more brief innovative project that we have done. And if I can, there we go. This is a cafeteria model learning style, much like an ECHO where you have community roundtable discussions, but this allows clinicians to, based on the topic, go through whatever form of activity they would like to learn about that topic for that month. For example, COVID is, for family planning providers, is in March. And so we have 2 podcasts, we have articles to read, and we also have subject matter experts that would be live on two occasions during the week that this cafe is open, to allow participants to listen to them give didactic information and to actively engage with the participants and answer questions or difficult cases. And then we also have some more fun kind of things where we do coffee and cases. So they're case challenges where they can go in and read the case and answer the questions, additional resources. And all of these things are open and accessible for the participants over that almost 10 days live activity, and where they can choose which learning modality they will have. So I know that we are running a little bit short on time, so I will not take a lot of your time up, but I do want to show you that thinking outside the box other than your Zoom or your voiceover PowerPoints are something that we are trying to do, particularly since we are experiencing some, virtual fatigue in participants. We're trying to move beyond passive learning where you have one subject matter expert, as mentioned earlier, one subject matter expert that is just relaying information and education to someone to passively absorb. And this is a way for people to actively engage. And I think these two models are innovative ideas that we have used to continue to provide that high quality continuing education. And both of the platforms that we have used have been approved for continuing education. And then finally, let me tell you that we are doing research on these two models to see how impactful they are. We're getting IRB approval. We have enhanced our evaluation process so that we can see if this is actually changing our clinicians out in the field and helping them improve the services that they provide and update and keep their practices updated. And I'd be happy to answer any questions that you all might have as we get back to the last panel, the last group.
Thank you, Kristen. So I want to invite Tony to turn on her camera. We do have a question in the chat box. Despite both of you doing some of this pre-COVID, what changes have you seen in participant satisfaction with these virtual labs and self-confidence to perform skills?
I'm happy to answer that. We actually started our virtual skills IUD training in October. And every time we do it better. And in our last evaluation, we had our highest satisfaction rate that we've had, and that was just in our March 1st training. I think that one of the reasons it's accepted and perceived well is that we made our groups smaller, but we are doing it more often. So we're actually training more providers than we were when we were face-to-face in larger trainings. But because we do them every 4 weeks, these small groups, kind of a peer cohort, can support each other in their learning in these new skills. And they actually do talk to each other about how they implemented it, how they mentored each other. Once they got back to practice the skills, they reach out to me. It's a very peer model. And so they're very supportive of one another. So our satisfaction gets better every time we do it.
And for us in Portland, we just received approval to go ahead and start doing the virtual nursing preceptorship. But the other thing, so we don't have anyone who has actually gone through it yet. It took a little while for Mountain West Regional Office to approve it. But one thing that I can say is that already, though, the staff who are already have signed up to do this, just their level of satisfaction in terms of participation has really increased the morale. So I think that we also have to consider that in itself, just because we created more of a community of practice amongst the staff versus just a couple people doing the nursing preceptorship in our previous model. I think really in itself will really support. I mean, we've always had a great reputation for our on-site nursing preceptorships, but I think just involving more people and kind of showing off their areas of expertise and just expansion in the clinic, because we have a really comprehensive program there, I think it's really going to be amazing, so that's what I have to share about that.
Thank you. And another question, how do you train your providers that they need to keep their presentation focused for the online presentation? So Kristen, did you want to start?
Yeah. I think, and Bruce might have mentioned this a little bit, that it's really important, particularly if you're doing slides, that you obviously they need to get them to you prior to the training itself. But then also, I think that less is more in this time, where to actually engage in the conversations with the trainer or the subject matter expert. I mean, we all know that adult learners learn in such different ways than say, an undergraduate or even an early graduate program, that adult learners are there for relevance. And if you don't make it relative to their learning, they're less likely to retain the information. And so we do a lot of interactions, particularly in engaging with stories about your own practice, things that went right or went wrong, how you improved it. Those are really good interactions to help them retain the knowledge. And I would say once again that, trying to get through 140 slides in an hour and a half is just, even if you tell participants the slides are available after the presentation, the likelihood that people are going to download those slides and go through all 140 of them really is not likely. So what are your key takeaways for the day? And make sure you're having a conversation around those, not just showing slide after slide.
And I agree, it's really doing the pre-work before the trainee is there and ready for that. It's just knowing what their needs are, what is their background, and like I said, for the nursing preceptorship, are we doing HIV 101 or are we doing 501? Really, we want to make sure that they are getting their best experience for them and tailoring it appropriately. And that's why we do the work. And so we really want to be intentional about making sure that we're building a relationship. We want to be able to have them complete the training, but also have a long-term relationship with them as well. And so that's, we work with the providers and give them the skills and the tools that they need, so that we want people to keep coming back, and referring more people.
Very true. Yeah, and as the National Clinical Training Center, we reach out to so many people, and we have, you build those networks and you become the reliable training resource. And so, that credibility is really important to us. And so we try to make it as comfortable as possible for people to freely ask questions. And we do surveys to find out what the field needs, and so we can tailor that year of education. So I think that's important as well, making sure that you're meeting your audience where their needs are.
Yes, very important. Thank you so much, Kristen and Tony, for your responses and for your presentations. At this time, I would like to invite all of our panelists to turn on their cameras. We would like to, again, thank you all to the panelists for your presentations. I think this information is extremely timely and really addresses a lot of the concerns that we're having in our different centers and the way that we're engaging our members or our trainees. So before we close, we really want to see if there are any additional questions. And I just want to bring to the panelists' attention one question that we received earlier, which is, how do you get people to turn their cameras on? Their video on. So I don't know if anyone wants to quickly address that.
Dave, go ahead.
Pick me. So I had shared that we have the agreements for an effective meeting space that we like to talk about right up front during a virtual session. That very first one is to please remain on camera. But having it as a discussion point allows us to unpack that a little more and show grace and understanding for those that might have to turn their camera off at times. But it's a way for us to just talk about it right up front, but at the same time, pair it with that sense of understanding as well.
I agree. We have the conversation in that, housekeeping model that everybody has at the beginning of a training. And because we are keeping them small, I think people appreciate the introductions and kind of getting that network across their peer group, meeting new people that do what they do. I think that they like that. But I'm completely understandable with, the mom that's got a kid in the background trying to go to school. So as long as we're engaging when the conversation starts, I'd like them to turn their cameras back on if we're in the discussion part of the training. But if they can't do that, we have to be forgiving in this time.
Thank you. Lisa, do you want to add to that?
Yeah, one I wanted to add, we also have a number of participants in our programs that are oftentimes in rural areas where they might have lower bandwidth, or they may be in a clinical setting where there may be some confidentiality issues, and so, or both. And so we often give a lot of permission in terms of keeping cameras off and audio, of course, in order to deal with both of those things, and just ask people to turn on cameras when they might be speaking, if they have the bandwidth for that.
I think you wanted to add to that as well.
Yeah, I absolutely second that around rural areas, especially that's something that we see a lot in New Mexico, where there are huge, very, very rural areas. We also tend to have a lot of participants at the Echo Institute who are out from outside the US. And bandwidth is a super big consideration in a lot of those places. And even when it is accessible, can be quite expensive. So we've had to temper some of our, like, come on, please put on your cameras, with realizing that it is really a challenge for some folks. And it's also a challenge if you've been on Zoom for 7 hours already and you are getting ready for hour 8 or hour 9. Sometimes you just have to, put yourself in someone else's shoes and go like, okay, you don't have your camera on, and that's okay.
Absolutely. So I just added to the chat, I want to hear from our participants. Thank you for attending and participating. But what's one takeaway from today's session? We want you to add that to the chat. And in the meantime, I just want to invite you all, for those who are not familiar with all the different partner training center networks, I invite you to go to the ATC NCRC website to learn more about the different centers and how you can connect with one another, because we want this conversation to continue and this collaboration to continue outside of these learning sessions. So we've gotten some responses, and I saw prepare. Another person said that they really enjoyed Mentimeter. We love this work. This was a good reminder to begin with the end in mind, and of course the chat waterfall. So thank you. These were all excellent. We're so glad that you were able to take away these mementos from our session today. So we will be sending an evaluation, and once the recording is processed, we will send that for any of our colleagues that have missed today's session. So again, we want to thank you for being here today. Victoria did add the link to the evaluation. So thank you all.